Hi, folks. My name is Greg Turner, the radiology coach. My job is to demystify the enigmatic world of x rays. When patients undergo a procedure in hospitals or medical centers, it is the legal responsibility of the healthcare staff to provide informed consent to them prior to when invasive treatments are administered. Because your average citizen is not well versed in medical terminology and clinical procedures, it is important that the patient understand what is about to happen to them. It all starts with a legal document that is presented by the physician or clinician who is performing the procedure. The doctor will present to the patient the details of the procedure and why it has been decided as the best option of treatment. This conversation includes the diagnosis, the nature and purpose of the recommended intervention, and the burdens, risks, and expected benefits of all options, including foregoing treatment. If the patient is having trouble understanding the information, then it is incumbent on the practitioner to share the information with a family member present. Once the information has been conveyed, the patient or family member is asked to sign the document as evidence the information was shared and all disclosures were presented. The document is then filed into the patient's record. Informed consent for patients is a critical part of healthcare, and as an accepted practice, it has become mainstream in hospitals and clinics. It is based on the second, third, and fifth tenets of the patient's Bill of Rights. These tenets are as follows in abbreviated format. A patient has the right to obtain understandable information about his or her diagnosis, treatment, and prognosis. The patient is entitled to discuss and request information related to specific procedures and treatments available, the risks involved, the possible length of recovery, and the medically reasonable alternatives. The patient has the right to make decisions about the plan of care. The American Medical Association eloquently addresses informed consent as fundamental in both ethics and law. Patients have the right to receive information and ask questions about recommended treatments so that they can make well-considered decisions about care. Successful communication in the patient-physician relationship fosters trust and supports shared decision-making. If a patient feels that they are not presented with an informed consent prior to an invasive procedure, then they must alert staff or their family immediately. Part of the patient experience involves an established trust with healthcare professionals. Patients must feel safe and know that there is no procedure that will be performed on them against their will or that would purposefully hurt them. Hospital stays or clinical treatment can be very scary to some, and yet if the patient trusts their caregivers and their rights are respected, then their experience will always manifest as positive. That concludes this episode of What is Informed Consent? If you like this presentation, please select the subscribe button below this video. You can also tap the bell next to it so that we'll notify you when other great videos have posted. My name is Greg Turner, and I'm the radiology coach. And remember, mark my word and mark your films.